Welcome to my channel. On today's video we are going to discuss to you about the common infections women get after sex and how to prevent them. As you are about to watch this video, like, comment, subscribe and share for orders to see. Hi everyone, welcome back to where we talk about health, wellness and everything you need to know to keep your body in top shape. Today we're diving into a topic that affects so many women, but isn't talked about enough. Infections after sex. If you've ever experienced discomfort, unusual discharge, or irritation after intimacy, you're not alone. In this video, we'll break down the most common infections women get after sex, what causes them, the symptoms to watch out for, and most importantly, how to prevent them. 1. Urinary tract infections, UTIs. Let's start with UTIs, one of the most common post-sex infections women experience. During sex, bacteria, especially E. coli, can be pushed into the urethra, leading to an infection in the urinary tract. Symptoms include a burning sensation when peeing, frequent urge to urinate, cloudy or strong-smelling urine. Prevention tips: always pee after sex to flush out bacteria. Stay hydrated. Drinking lots of water helps clear bacteria from your system. Practice good hygiene. Both you and your partner should wash up before sex. 2. Yeast infections. Next, let's talk about yeast infections, caused by an overgrowth of the fungus Candida. Sex doesn't directly cause yeast infections, but irritation, new sexual partners, or using scented products can disrupt your vaginal pH and lead to yeast overgrowth. Symptoms include thick, white discharge, often described as cottage cheese-like, itching, burning, or redness around the vagina. Prevention tips: avoid scented lubricants, soaps, or douches. Wear breathable cotton underwear. If you're prone to yeast infections, consider probiotics to maintain a healthy vaginal flora. 3. Bacterial vaginosis, BV. BV is another common infection linked to sex, especially if you're having sex with new partners. It happens when the balance of good and bad bacteria in the vagina gets thrown off. Symptoms include thin, grayish discharge, a strong fishy odor, especially after sex, mild itching. Prevention tips: limit the number of sexual partners. Use condoms to reduce risk. Avoid douching as it disrupts your natural pH. 4. Sexually transmitted infections, STDs. STDs are infections passed through sexual contact, and some of them can show symptoms right after sex. Common STIs women may experience include chlamydia, gonorrhea, trichomoniasis, herpes. Symptoms vary, but may include unusual discharge, painful urination, sores or blisters, pelvic pain. Prevention tips: always use condoms or dental dams. Get regularly tested, especially with new partners. Have open conversations with your partner about STI status. 5. Postcoital vaginal irritation. Sometimes it's not a full-blown infection but just irritation after sex. This can happen from friction, allergies to latex condoms, or sensitivity to certain lubricants. Symptoms include redness and swelling, mild burning or itching. Prevention tips: use water-based lubricants if you have sensitivities. Switch to non-latex condoms if latex is a problem. If symptoms persist, see a healthcare provider to rule out infections. General prevention tips: 7 to 8:30. Across the board, there are some universal tips to reduce the risk of infections after sex. Pee after sex. This simple habit helps clear bacteria from your urethra. Maintain good hygiene. Wash your genital area with warm water. Avoid harsh soaps. Stay hydrated. Drinking plenty of water supports a healthy urinary tract. Practice safe sex. Condoms protect against many STIs and help maintain vaginal health. Know your body. Pay attention to changes and don't ignore unusual symptoms. When to see a doctor: 8:30 to 9:15. It's important to know when you should seek medical help. If you notice persistent itching, burning or discharge, foul odors, pain during sex or urination, unexplained sores or rashes, don't wait. See your doctor or gynecologist for a proper diagnosis and treatment. Taking care of your sexual health is a key part of your overall well-being. If you found this video helpful, give it a thumbs up and subscribe for more health tips and discussions. And if you have any questions or topics you'd like us to cover, drop them in the comments below. Thanks for watching and take care of yourself.